So what is contact tracing? There are a number of measures we can take to reduce the risk of spreading infectious diseases such as COVID-19. One of the main ways is by contact tracing. Contact tracing is a tried and tested way of suppressing infectious diseases which has been used effectively around the world for many, many years. So how does contact tracing actually work? When someone has an infectious disease such as COVID-19, they can pass it on to other people through close contact, even if they don't have any symptoms. Those people can then pass it on to other people and so on. If one person passes the disease on to 3 other people, we now have 3 more people with the disease who could then potentially become ill and pass it on. If those 3 new people pass the disease on to 3 others, that will be 9 more people who might have the disease. That's 13 in total. If everybody who has the disease passes it on to their contacts, then within weeks there will be hundreds of new cases, all from one initial case. Left unchecked, the disease will continue to spread rapidly and will grow into thousands and thousands of cases quite quickly. Contact tracing involves working with someone who has an infectious disease, such as COVID-19, to identify the people who they have been in close contact with, whilst they may have been infectious, and then asking those close contacts to self-isolate. Self-isolation means avoiding going out or seeing other people in person for a specified period of time. This ensures that if the contact of the original case developed the disease, they will not have been in contact with other people and will not have passed the disease on any further. This is known as breaking the chain of transmission. If we do this effectively, we can stop the spread of an infectious disease in its tracks. But what is needed to make contact tracing effective? It needs people who develop COVID-19 to self-isolate and to share the details of their close contacts. It needs people who are identified as close contacts to self-isolate to make sure they don't spread the disease any further. It needs people who are self-isolating to be supported to ensure they can do so safely and with the minimum amount of disruption to their lives. Contact tracing is vital when it comes to controlling the spread of infectious diseases such as COVID-19 and is one of the main ways in which we can return to normality and protect our most vulnerable citizens. By working together, we can make a real difference.